Hi, my name is Becky, and I'm a clinical coordinator for Dr. David Broadway. Thank you for viewing this video. Today I'm going to present information to you that will help you understand your upcoming pre-op and the procedure that you're going to be having with Dr. Broadway. Please plan on spending about 90 minutes or an hour and a half in our office for your pre-op appointment. When you come in, you'll meet with Dr. Broadway, and he will go over the consent for your surgery as well as explain surgical risks for you. He'll be presenting your prescriptions to you, and they look like this. So they're actual prescriptions that you'll take to your pharmacy to get them filled. People often ask, are my prescriptions covered by insurance? If you have medical insurance, they'll be covered at whatever level that your insurance provides. So some of the things that we'll be giving you is going to be pain medication, a muscle relaxer, as well as an antibiotic. So we also give you 2 anti-nausea medications. One is an oral medication that you can use if you have post-operative nausea. The other is a patch. It's a small patch that the surgery staff will put behind your ear, and you can wear that for a couple days after your surgery. If you experience blurry vision or dry mouth, you can easily remove that patch after surgery. The other things that we'll be giving you, we'll be giving you 1 sleeping pill, which you can use, and it's optional the night before your procedure. So you only have to use it if you feel like you're not going to be able to sleep. And then we give you a couple different products that we ask you to use prior to surgery. One of them is Hibiclens. And this sheet, which is in your pre-op packet, will help you understand how to use these products. Hibiclens is listed on your prescription, but you can purchase it over the counter. So when you go to the pharmacy to get your prescription, simply ask the pharmacist where to locate the Hibiclens. You'll take your shower, and this is applied to your surgical site, and it helps minimize post-op surgical infections at the site. So you'll take your shower, dry off, and then you'll apply this, it's kind of like a lotion, to your surgical area. For instance, if you're having a breast augmentation, you would apply it from your clavicle to right below your rib cage. And then you just let it dry, and then you put your clothes on. You'll start this product 5 days prior to your procedure and use it once a day. You can use it morning or night, it doesn't matter when you shower. The other product you'll be getting, and this only is given to patients who are having breast augmentation or an implant, is called Mupirocin 2% ointment. This ointment is used also starting 5 days prior, and on this sheet it shows you how to use it. You use it in your nose, and you just put a little strip in each nostril, kind of rub it together for about a minute, and twice a day, 5 days prior. One of the questions people always ask is, how do you count that 5 days? So you have 5 full days before your surgery, and the day of your surgery would actually be the 6th day. So you could use that the morning before you come in for your procedure. So those are your medications, and we do ask that you get them filled and bring them with you the day of your procedure. It's important that you bring them to the surgery center so they can apply your patch, as well as the nurses know which medications you're taking, and then that helps them with your discharge instructions. You are also going to receive a surgery brochure. This comes from the Renewal Surgery Center. Our office is in Suite 200, and your surgery will be performed in Suite 210. So it's right outside of our office and right around the curve. Please take time to review this brochure. There's very important information in here regarding the no eating, drinking policy, how you should wear, what you should wear to come to surgery. So we ask that you use loose-fitting clothing, something that zips or buttons, that's easy to get in and out of. It also talks about no jewelry, no makeup. You must have a ride home from your procedure. When you arrive at the surgery center, they'll ask you who your ride's going to be and what their phone number is, and they'll probably contact them and let them know what time to be back. And I do understand some people have caregivers that wait for them. It's also required that you have somebody with you the first 24 hours after surgery. Your time of surgery and your check-in time will also be located in this brochure. So it's in 2 places. It's in the front of your pre-op packet, and then it's in this brochure. anesthesia the anesthesiologist will call you the night before your surgery, and one of the nurses will attempt to call you between the time you schedule your surgery and the day of your surgery. If you don't hear from them or you miss their phone call, please do not be concerned. They will discuss things with you the morning when you arrive. So make sure you review your surgery center brochure. It's required that you have a blood draw prior to your procedure. This is a blood draw that is included in your surgical costs. You simply take this form, and you do need to go to a Quest lab. We give you an entire listing of Quest laboratories. You can go to any one of these. It gives their hours of operation. You can go online and make an appointment. There's an online address up here, only if you want to, or you can simply walk in during the hours that they're open. You do not need to fast prior to going in for your blood draw. You simply go in, sign in. They probably will ask you for identification, but they shouldn't ask for insurance information because it says right here, bill account, which is Dr. Broadway. The little black dots that are on your lab are the labs that we're drawing for your specific procedure. We do request that you do this as soon as you can after your pre-op visit, and that way it gives us time to make sure everything is okay and we don't need to do anything else prior to your surgery. If you're having a breast augmentation, you will wear a strap that looks like this. It's actually called a bandeau, and we refer to it as a strap or a bandeau. The way this is worn, and you will have one of these on when you leave the surgery center, is it is above your breast implants. It has Velcro on it, and we want you to wear it right up in your armpits. It does slide down, so it is okay. Don't be afraid to move it up. What this does is it's a tool to help your implant settle. So you wear it high and you wear it firm. We don't want you to be totally miserable, but we want some good pressure on that upper part of that implant. Now you can see that this is up in my armpits and it is not over my breasts. We want it right in your armpits. The average person wears this about a week, sometimes longer, sometimes less. Your post-op caregiver or Dr. Broadway will tell you when it's time to dispose of this, and then you can simply throw it away when it's time. They'll let you know when you can get rid of your bandeau and when it's time to go into a bra. So please wear this 24/7. You can sleep in it. You cannot shower until your drains come out, so you wouldn't be showering at that point. But once your drains are pulled and you take a shower, then obviously you would take this off while you take a shower. So please wear this until we tell you it's time to dispose of it. I want to show you how to use your Jackson Pratt drains. They look like this, everybody's favorite. I know people are really intimidated by these, but we get people through it and it's not as big of a deal as you might think. So you do have actual instructions on how to use this. These two forms are located in your pre-op packet, and I'm going to give you a demonstration of how to use it, as well as how to keep track of your drainage. So this bulb, and you will have two of them, one in the right breast, one in the left breast. If you're having liposuction or a tummy tuck, they will be located in different parts of your body depending on where you have your surgery. So these little tubes, you have one, I'm going to give breast as an example. You have one in each side, and it's just sewn in with one little suture. So this is laying inside your pocket. One of the things I want to point out is breast augmentation's two separate surgeries. Do not expect to have the same amount of drainage in each of your bulbs. It is okay to have different amounts of drainage, and it does start out pretty dark red. Don't let that alarm you, and it does get a lighter color as the days go by. You can have drains, depending on your surgery, anywhere from a couple days for breast augmentation. It can be longer for breast augmentation, and lipo and tummy tucks, it's usually about 2 weeks. And then that varies as well. You may get drains pulled before the 2-week mark, and you may get drains pulled after the 2-week mark. So the way these work, you do have a little tab here that you can pin to your clothes, and when you leave the surgery center, they'll already be attached to your clothing. I've seen people put them in hoodie pockets. You can get creative. I've seen people with a little lanyard around their neck, and they lace that little tab through it and hide it with a scarf. Seen them wear them that way. The nurses will also write like A, B, C, D on these. If you have liposuction, tummy tucks. If you have breast augmentation, they may write A or B, or right or left. So on your drainage record, you have columns that are marked A, B, C, D. Hopefully you won't have drains for all those columns. And we also write up here, if you're having breast augmentation, right and left. So this is where you're going to keep track of your drainage. The way these work, this does not come apart. The tubing that goes into your body, you do not take this apart. You only open and close from this shorter little stopper right here. When you leave the surgery center, your bulbs will be in this position. So every time you empty your bulbs, you just push the air out, one good squeeze, and you close the lid. Now you'll be having these one on each side, and you'll be wearing them around, and you just keep an eye on them. People always say, well, when do I empty them? You can empty them at any time. We just don't want them to get more than about halfway full. So if your fluid is at this level down here, and you want to go to bed, feel free to empty it as long as you document on your little worksheet here. So the way you empty it, you take the lid off, you let the fluid settle into the bulb, and there are actual numbers on the bulbs. Whatever level that fluid settles to and stops, that is the amount of drainage that you're going to document on your worksheet in the appropriate column that matches up to your drain site. So the way you would empty it is you're attached, so you go to the restroom, you go to your bathroom, and once again, this is the only open and close valve, and you would empty this into your toilet, giving it a few good squeezes. So it might take a couple squeezes to get that emptied out. And then you can wipe the outside of the bulb, but do not rinse the inside because the inside's sterile. And obviously we like to keep the outside as clean as possible, but you could just wipe it off, push the air out, and close the lid until next time. The other thing we ask you to do, maybe 3 or 4 times a day, is we ask you to strip or milk these tubes. The way you do that, your bulb will be in the compressed position. You lay it down on a clean surface. We do try and encourage you to lay this down on a clean surface. So lay it down on a clean surface. Now, if I let this go, it's going to fill up with air because there's holes in the end of the drain. So try and keep it in the compressed position, lay it down, and you would simply take this tubing at the site where it goes into your body, and you just start between your index finger and your thumb, give it a good squeeze, and don't be afraid to really stretch the tubing and strip it down towards the bulb. So you can see that I'm stripping it towards the bulb. So you could strip it a couple times, and this just really helps the tubing not clot up. You may see little bits of things through here. That's okay. You can give them a good squeeze and a good stripping, and that just helps keep things patent through here. So try and do that about 3 or 4 times a day. Your drainage record is important because that is really the only way we know when we can pull your drains. So you'll see you'll have dates along the side, and then we always ask that you put the time on the drainage record, and we want to know if it's AM or PM. So for instance, let's say it's 10 AM. So you'd write 10 AM. And how much did you empty out of your right drain and your left drain? It does instruct on the top here that it's important that you bring this drainage record to all of your appointments. If you still have drains, we want you to bring your drainage record. And it also mentions that you need to empty your bulbs about 1 hour prior to coming in. Now we understand some people live more than an hour away. Don't worry about the exact time, but we would like you to empty them before you come in because we want to see fresh drainage. As these start to slow down, we just don't want to see drainage that's 6, 8, 10 hours old. So please try and bring them in with fresh drainage in them. And that's how you keep track of your drainage. It's pretty straightforward. If you have a surgery that requires drains for a longer period of time and you run out of space on your drainage record, don't worry, we'll give you another drainage record when you come in for one of your checkups. Thank you for viewing this video. Hopefully it will help you prepare for your surgery. Please feel free to look at it over and over. It has a lot of great information in it. People are very nervous when they come in. They're very anxious. That's very normal. We want to reassure you that we're here every step of the way, from your scheduling your surgery through your pre-op appointment, and we have great post-op caregivers as well that will help you along with Dr. Broadway. Please feel free to call us to ask any questions, and we look forward to working with you so that you have a really positive experience. Thank you.